6:09, January 12th. My name is Marian Peña. Welcome. We're actually gonna, you wanna do introductions or?
Yes.
All right, so.
Committee Board Member Audrey De Jesus.
Tyreek Israel, new committee board member.
Welcome.
Welcome, hurrah! Christine Macada, Community Board Member.
Stephen Palmer's Community Coordinator.
Reverend Oswald Dennis, Community Board Member / Lincoln Hospital.
Welcome.
Welcome.
Good evening, Madam Chair, ladies and gentlemen. Anthony Jordan, District Manager to the board. Just a reminder that our meeting is being broadcast live on the Community Board One YouTube page. In addition, it is also, if you're speaking for the first time, make sure you say your first and last name so that our honor system can pick it up for the official minutes of the board. Thank you, Madam Chair, ladies and gentlemen.
Yay. All right, so we're gonna go straight to old business because it's something that we've been discussing for a very long time. We are very passionate about the health disparities that's happening in this area and also throughout the Bronx, but mostly in this area. So we're gonna start off what we have on the agenda is the health survey. And I know I shoot you guys an email today. I'm gonna be in communication with you guys a little bit much more regularly because of the fact that we wanna ensure that we're conducting these outreach to the community. And the way we wanna hold the health survey is, as District Manager mentioned, we are gonna have some interns who's gonna pretty much create like a form, a QR code form with questionnaires for the community where it's not like, they're not overthinking on what to respond, but it could be either drop down or just like to provide an input on what's their concerns. Everyone has different concerns and we want to be able to tally that and also be able to tackle all the concerns, but in a much more organized way where if we can't be able to, compete in a health fair or symposium, we can be able to continue to provide those services moving forward. And so I just want to open that to the floor to get any ideas, if you guys have any specific questions that we can add. We left it for 5, but I think we can open it to I don't know, you give me an input up to 10. We don't want to overwhelm the community too, but also we don't want to overwhelm the people who are gonna like scan the QR code. It's like there's too much to answer. We want to be mindful on that. So I'm opening the floor. You guys can chime in and let me know what you guys think.
So, 10 questions we're gonna put on the survey?
I said 5 at first, but I guess depending on what we speak with the intern teams and also everyone else, we can try to figure out maybe it could be 5, 6, 7, or whatever it is.
So we could generate 20 and then condense it down to the 5 main meat of the survey.
Right.
You want to add to it first? So a little bit backwards. Thank you, Chair. So that we know that the South Bronx is the chair. This has been something that she's been conceiving and for a very long time, and all the groups have been conceiving and her leadership as the Health and Human Services and LGBTQIA committee chair around health disparities. We know the South Bronx is 62 of 62 counties of the most serious health disparities that has been impacting the South Bronx. And so, in her wisdom, the chair wanted us to focus on those disparities for the new year under the new leadership of the board, and those disparities, it will be dictated by this committee handing out our QR code. And so the chair, in her wisdom, directed the staff to be able to go and find people who will work for free. And that people who could find to work for free, we found the full board chair, Paolo Martinez, and in my opinion, we got students from Lehman College, bachelor's in health administration program, who are very eager to be able to work on, like the chair mentioned, developing a questionnaire. And we wanted to keep it simple because simple brings probably more participation. More people the larger it was, the concern was people will say, I can't fill this all out, and then you will leave a lot of unanswered questions. And so if you have a small 5-question, 6-question max survey on what are some of the health disparities you think are very permanent out in the South Bronx community, and so diabetes, women's health, whatever those things that you guys identify, those questions that we should be asking. In addition, on what are some of the things are the other primary health issues. So those questions are all questions that I will not go into because the chair hates when I overspeak. As much so over top, but it is to draw out this committee's work and understanding where the focus should be, because we already have 10 meetings for the entire session for the community board, and so in those 10 meetings we have to shrink that into what we're trying to accomplish. She's going to touch on what those questionnaires will mean for us going forward. So these questions will start spinning off some other ideas that she's going to talk about. I don't want to jump the boat. Just think and shout them out, and so that our system could be able to generate that document. Thank you, Chair.
Sure.
I should say my name before I start speaking.
The first time, yes.
Tariq Israel. So a couple things. These kind of surveys exist already.
Mm-hmm.
So just be sure to see if we reach out specifically to our elected officials. I know this is something, the campaign that we did in our office in C3 and 4. It's definitely worthwhile to see what already exists out there.
Mm-hmm.
I can tell you from the feedback from the constituency there, a lot of them like to deal in paper. So the QR code there was definitely some digital literacy barriers there. So it's going to be very key to have this information kind of ready to go, clipboarded out, and just ready to go as necessary. It's also really cool to pair it up with an event.
Yes.
So if there's something going on already, just hosting a table and having a community survey at a table.
Saturday food pantry.
Yeah.
She's actually kicking it. We have a food pantry program we're going to be part of doing.
Yeah.
We have about how you say for people at the book exchange. So we're definitely on
I
par
think
with
that
what
would
you're
be
thinking.
so important, because it's not just tackling my community.
We can get some to Dennis, and
tackling-
when he goes to the hospital, sneak into the hospital.
But it's also tackling everybody else's committee, right? You have children and youth, the youth committee, you have all these other committees that focus on specific things, but also health is always the number one issue.
Yeah.
And so I agree with that.
It's definitely also worthwhile, like you were saying, with partnerships, to just probably have one survey for everything. So maybe 5 questions on health and wellness, but then 5 questions on children and youth. Because people really, we found that people really got into the things that they cared about, and it was very visual. So it helped guide where we needed to put some more work into build out things that they're interested in, but also what was already working and what was in a good space, so that we can continue down that path. So we can kind of create markers for ourselves on what we're doing right and where we need to improve.
So then also, we could ask when they're doing the surveys if they have insurance, because the insecurities of them getting treatments and all that, because lack of
The insurance.
and whether it's private, whether they co-pay or they have job insurance, that could be a question in the survey.
Yeah.
So we tackled all of that during our brainstorming last week.
Oh.
And I want to share it with you guys. Aside from what Christina had created, she created you have the paper with you, right? She created pretty much a brainstorm document. Yeah, you guys all have one.
Yes.
Yeah, all have one. Yeah. And so this was all as of last year. This is from last year, and there was a lot of things that were happening, and just it wasn't like the right moment. There was so many things happening with the government and everything else that everyone was out of frantic, especially the government shutdown. And so, I'm sorry.
That's what it's in the
I'm
loop.
so sorry.
I'm sorry. My bad. I'm like, where is it? I'm looking for it.
I'm so sorry. That
I got
was hilarious.
it.
I gave you the eye contact. I thought he was nodding with me like, yeah. I'm like, yeah. He's like, where's the paper?
But I think that because I breezed through it, but there's gotta be a way when they do survey that this is no like she said, there's no judgment there, but that we wanna provide services, but on the end note about how they're gonna get those services.
Yeah.
They
Yeah.
need to
So here's
fund it.
what we brainstormed last week, and that's why I wanted to give you guys the input. So I didn't print this out for everyone because there's gonna be more add-ons, and eventually you guys have been so helpful with the inputs. So, we realized that we just entered one of the craziest times of insurance right now.
Yeah.
There are some discrepancies happening.
Nurses
There
are
are
strike
people,
right now.
there's nurses on strike.
Yeah.
There are people who are paying health insurance as if they're paying a mortgage.
Yeah.
And so we have to also be mindful when we're doing, the survey, because it's gonna be in connection with the health symposium that we're gonna do and the health fair. So all of this is leading up to the two most important things that we have to be able to secure this year, which we are, is the health symposium that the district manager is gonna explain in a little bit what that is, and that's something that we all have been discussing against this last year, and the health fair. The health fair, there are a lot of people that I have spoken to within the past couple of weeks where they are afraid. They don't want to walk into the walk-in office. They don't want to go to the hospital. They're uninsured. They're scared of ICE. They're unregistered. There is a long list of things. And how can we as a community be able to support? Yeah, right? And so it's important for us to hear the community out, and these surveys, paper, QR, whatever it is, even on social media, outreach, being able to reach out to people to come to the general board meeting, because that's where it starts, right? We have to engage. I think that's important for us to try to figure that out. And so what we wrote down was a lot of the stuff that I want to make sure that I can be able to discuss. So I guess I'm saying who we're gonna invite, right?
Yep.
Whether it's insurance. So we do want we want mobile screenings, mobile clinics. We want like how I spoke to you before, it's like an event. It's an event for babies to seniors. We have people, I selected the place already, we selected the place. I felt that if we select Lincoln Hospital, that's gonna be too much for the people. People are not gonna wanna go into the hospital to get screened or whatever it is. I selected Pulaski Park. The reason for that is because that entire area, I feel like it has been unutilized, and also not enough outreach has been done out there.
Yeah.
And there are people the community are angry, and so they're frustrated because they can't be able to go and travel all the way over here to a meeting or whatever. So let's be able to cater to every community, and let's start off with that community first. What do you think? Yeah.
Where's Pulaski Park?
Right there in Buckner. It's not that far from you.
It's in between Mitchell's and
Over there.
Milford.
Oh, that's what the Humboldt Court is and all that.
Well, it used to be at. Yeah. I said that would be a really good park.
It
It's
is.
big, it's renovated, it's a
Nice.
playground, it's lights. The district manager, are you able to put it in the TV so that everybody
Sure,
can
yes.
see it?
Yes, ma'am.
I am in the works with the blueprint. I already have the blueprint. District manager is gonna be able to secure the permit.
So we could ask Freddie if he could donate some tents for the shade,
Well, I haven't even, this is just brainstorming with
Yeah,
you guys.
that's part of our brainstorming.
Now the date.
Our vendors.
So the day I selected, August 2nd on a Sunday.
My birthday.
That's really, so, but also I need you guys to give me input because it is on a Sunday. Is that something that you guys would think it's feasible to do?
I don't think you should do it
Nah.
on Sunday.
Saturday is the best day.
Yeah.
Especially in the summertime.
No, the summertime is any day, but not a Sunday, because that's when they really.
People
that's
go
a
to
family
church,
day.
they don't
Yeah.
really want to interrupt that.
So I think we need to change that,
Any day but a Sunday.
Christina?
I'm fine with either, but I think Sunday is kind of the day before people work.
Yeah, and I agree that's why I was like, I think it would make sense either on a Saturday
Maybe
as
as they're
well.
doing errands on the Saturday.
Yeah.
You know.
So Saturday, it is perfect. All right, so I think that's the whole point of me brainstorming with you guys because it's something that's important.
What's the address, Chair?
Pulaski Park, just put Pulaski
Yeah, I
Park.
just looked it up. It's right around the corner from me, but I didn't realize
Yeah, Pulaski.
that's what it was
In the
called.
Bronx.
Pulaski
I didn't realize it was called Pulaski Park.
Is it
By Willis,
PUL?
right?
PUL,
PUL.
It's PUL.
S-
PUL.
SKI.
ASKI.
I didn't realize
Is that-
Pulaski Park.
Is it? Is that how I spelled it? It's my bad. Oh my bad. That was a typo. I think that was a typo.
You'll figure it. I got faith in Mr. Jordan.
So you could just put 101 Bruckner and it's right there because that's our new building.
Heaven can wait.
That's it right there.
There you go.
I didn't realize.
They renovated.
I live in
Yeah.
138, like 2 minutes away
It's
from
so
me.
gorgeous.
I didn't realize that's what it was called.
You see that? That's my vision. I think it's important for us to understand this park
Oh,
needs to be utilized.
yeah.
We want to be able to get all elected officials,
We could even tie in with the DOT so they could bring free helmets to give to the kids.
and then have like parks. They normally do events there at that park, especially like roller skate events and things of that nature. So my son always goes. I think that would be an invite
Another
to just have people.
So what's the Saturday? The Sunday date was originally.
The Sunday was August 2nd, and
So
then
now we
the
moved
rain.
to Saturday. Now they would have moved to Saturday.
August
Yeah.
1st.
Yeah, August 1st.
And then rain day could be the following Saturday?
The 2 weeks. So that we said that the 16th for the rain day, so it would be the 15th. I
August
think
1st,
that
right?
makes sense.
Before my birthday,
I think there's also an opportunity to partner with the Economic Development Committee because there's a bunch of small businesses on the strip there on Bruckner. I know specifically there's the what's it called? The CrossFit gym across the street.
Oh yeah.
So it'll be a great opportunity to partner with them and bring maybe some activities for the people, but also maybe there's some food donations to Sobro. Because they're really.
I already spoke to someone. I spoke to Steve. He said not a problem. We just have to. I don't have anybody's connection, so you have to do the email because we have to do the email first now because it's 6 months, and we want to be able to secure the permit. So
The permits you come, that's our committee.
no, in terms of for the parks.
No.
We don't need permits for that.
The Parks Committee, but the Parks Department. It's not going to be in the streets. You're not closing the
Oh, it's in
street
the park.
in the park.
Oh, I didn't know it was a separate permit. That's cool. I learned something new
It's
today.
a different portal.
Mhm.
Yeah.
You don't talk to
CAU
yeah, you don't
or
talk to them there or something.
whatever it's called now.
Yeah.
Mass engagement.
And-
Sorry.
Anyway.
Yeah.
We all the time.
So you guys tell me if you guys have any other comments on it.
It's a good idea.
We're catering everyone. We're catering.
No,
Yeah.
that's not,
Mhm.
you just messed up my
My
train
bad.
of thought,
Is it
but,
both the symposium and fair?
So we're doing two separate. So,
Give me
District
your chance to
Manager Anthony, can you please chime in on the
Sure.
symposium?
So we're talking about, we understand what the health questionnaire is the base, it's the foundation of what we're trying to look at. Now we understand, like I was talking about that, the South Bronx, unfortunately, for a very long period of time, 62, and we understand that we have, unfortunately, the poorest outcomes for overcoming from health-related issues. COVID showed us a lot, but even pre-COVID, it showed us that we had Black and brown people do not take advantage of going to the doctor. Our healthcare systems and certain aspects of certain communities have been failing our community, providing opportunities for folks to use holistic or use ways to help work on preventative awareness. So we want to create a standard for stronger health systems. But also we believe in doing that is by educating the constituent, the common Joe and Jane Nick Bone, so they could become educated or more engaging patient in the hospital. We want to set a standard in our healthcare system to help to improve it at least to 1 point or whatever the goal is eventually over a period of time, 5 points. But meaning that we're moving up from the 62 up into creating more healthier standards. How do we do that? We have to educate our population on what are the different comorbidities or health issues that have been impacting us sooner than our community that have been was at least a decade or so ago. More people are impacting with colon cancer, where usually you have to get your colonoscopies or so on at 40, some people at 45 or 50. Now you have to get it even, people recommend to get it done at 30. We know that some people are impacting obesity, heart disease, diabetes, all these issues so we have to do a better job at educating our folks. So we're looking at working with our partners. The plan is to work with our partners at Lincoln Hospital to host a symposium, a place where we are speaking in layman terms, educating our population in layman's language, so that's commonly understood about what are the health issues that the questionnaire outlines are some of the issues or concerns. So, say for example, we do this the questionnaire. Percentage shows that people in our community are more concerned about diabetes, concerned about heart disease, concerned about whatever the outcomes of that the questionnaire does, and we perform an 8-series class. I mean, one class a week, where we have specialists, practitioners in those areas come in and talk soup to nuts about that issue, and then we arm the constituents who come to those classes with composition notebook, so they start writing questions they may have for their doctor around these issues that their symptoms that they've been impacting, issues that are concerned, historic data or DNA that has been that they never asked before, questions they need to ask, so that what they're exchanging now in the doctor's office is not a one-off. Let me take your temperature, your vitals. Let me take your for your prescriptions. Have a great day. It's more now you're having an educated conversation with your doctor. That interaction is lasting at least 15 minutes more than usual, so that you are learning more about what may be your issue, what may how to explain your symptoms, what are preventive measures you should be taking for those symptoms that are or those issues that are reversible, like diabetes and so on. What are some of the questions about the medication that's out there? What are some of the side effects you've been experiencing for those who are taking medication? Yeah. I know a lot of people have been taking medication for weight loss medication, but they're not aware of the side effects or high effects for them. All the different issues. And so we want to create a more educated patient force that's there in the same way creating the standard of what our hospitals, what our federal qualified health centers, what our the doctor's offices, Essence Health, others are doing to be able to basically serve our people. So the part first is symposium is educating. Part two is the health fair, where we if I may speak on that a little bit, Chair.
Yeah.
The health fair is having mobile clinics that are out there, dental, breast cancer, A1s, diabetes or testing spaces, health insurances, because some people talked about not having health insurances that are affordable, that are available. That like we know that Lincoln has a health Metro Plus that's there. That's there are people. A lot of folks are experiencing that who maybe qualify for Medicaid, Medicare, especially Medicare. I got in this office. We recently got an uptick in senior citizens who need assistance in filling out Medicare applications because they're people that's changed. And then lastly, we want to challenge food policy. Having options in our community without having to push and protest our not only our fast food or our restaurants establishments, but also our supermarkets. What type of that's the name of Stevens there. Oh,
Okay, go ahead.
It's open, Hugh.
But I wanted
I'm sorry. So those are so we want to be able to make sure that this is what the health symposium is supposed to do. So let's talk about the timeline. So between the months. Okay, sorry.
I didn't want to interrupt, but I want to confirm the location for the health symposium.
So the goal of the health symposium is to be able to host it at Lincoln Hospital's new and improved auditorium. That happens. We're working, so we got to first we have to design everything, do the planning, then we go with the baking.
Yeah.
So it's the planning conversation for us.
The thing that I don't want it to be my worry or anyone's worry is the following: the fact that we're speaking about the health fair, that is going to be in August. However, the health symposium is going to be. We said April, May.
That's when likely we were told by Lincoln's team when our return will likely be ribbon cut and ready to
So
open
then
up.
is he going to be in communication with us on that?
You bet, all the way.
And the vision of it is an 8-part series.
It's an 8-part series
Okay,
starting from April. So 4 weeks in April, 4 weeks in May, spring, conversation, We have a lot of specialist doctors in Lincoln. We have some of the other federally qualified centers. We have some other folks from different Bronx-based medical facilities
Right.
that can provide.
And again, what does that look like? And what I'm saying is that because we're talking about the survey and doing the outreach and doing everything that was provided as an input, I think that's important because we need to figure out how that series is going to play out.
Mm-hmm.
Right. So go ahead.
So I have a few things.
Yes.
I know you said a question again. One more thing. Well, you keep stopping. You wrote those down somewhere? No, is it?
I got it.
Okay,
It's not
ready.
recorded. Go ahead.
First, Tyreek is bro. First, I want to say, I love the idea of having conversations around health and wellness in a symposium
It's important.
factor, because there's a lot of people who don't know. And even in when I was a kid, like I went to school and I ate a bacon and cheese before school, and then after school I stopped at Pizza Hut and got breadsticks, and then I went home and ate dinner, not realizing that's like a 4,000 calorie diet. Before I even, I was running around at the time. Can't do that now, but
As we get older, we cannot do that.
Yeah.
I don't recommend it.
Your body changes.
Yes. I say all that to say, none of these conversations have a foothold when there's not a local place to get salad, or there's not a local place to get access to fresh fruits. And so we really need to be having also part of the conversation where the access points in our community, and start to build out a map through this committee of where these access points exist. So I know we have green markets in the city, and they're active typically from like July through November.
Yeah.
Some are year round. How can we create more access points here in our communities, and how can we get our elected officials to commit to securing health bugs for the community so that community members can access fresh fruits and groceries at a discounted rate from their elected officials
Without the SNAP benefits.
So like I know,
And
for
that's
example,
important.
our office gives out we do a tier system. So we start out $12, we go down to $10, and we go down to $8, and we go down to $6 and $4. And it's all in essence to just spread the wealth as much as possible and get people access to these markets. The average vegetable costs about $4. At a $12 market, you can get 3 different sets of vegetables. I don't know about you, but that sounds like soup to me. Also, and that also to move past that conversation, when we're talking about the symposium, if we're saying that there are barriers in between people understanding the health field and them accessing it, my personal recommendation is we shouldn't be inside. We should be outside. We should be right here in the hub. We should be right here talking to people and having this live conversation on the streets. Why? It's because the people who are walking by are going to benefit way more than the people who are going to come to it, because we know our people are not interested in taking care of their bodies on their own volition. They wait for a doctor to tell them, you have this before we start to do something. So if we get out there ahead of time and start having this conversation live, maybe somebody who stopped to wait for the bus can now learn about insurance while they're waiting. Or maybe somebody who stopped to go to Domino's can now learn about the different kind of things that can access. And if this is an 8-part series, we have 8 opportunities to go here with thousands of people cross this transverse every day and get those amount of people educated on health and wellness. That's what.
Yeah, maybe right there in the hub, Roberta Clinic.
Yeah.
So
obviously spaces inside is important because it's going to be spring, rain, but
not only that, we also going to be. I have to make sure that when you're discussing health, whether HIPAA rules require certain things, and so that's how I was just thinking about in indoor space, and I wanted to give Lincoln a chance to show up that spot. But I hear what you're saying. In addition to that, I was thinking about we had a very passionate, I think, 5-hour conversation about this, and so about the health bugs piece that we even thought about that, not about the map part, which is a good part, but even adding cooking classes to what are healthy alternatives that are in the community. So working with groups like City Harvest, who promotes, and the Hunts Point Market, who gives, because we have a fresh produce that we give out here, and the food for New York City, so that we can be able to talk about how do you make healthier, tasty options, culturally sensitive options that are more healthier, because people, we understand, like you talked about, people, not only are people younger or people are older, because the way we are programmed in society, fast is better, it's cheaper, and it's more accessible. We talked about this administration is talking about affordability. This is a great opportunity to talk about how affordability could tie into living longer, not only tie into having quality housing, not only tie into all that stuff, so we can be able to challenge the work, the mission, the platform of this administration by talking about affordability around gyms and the contracts that we get locked into, because they're talking about the jump fees and so on that go into it. So this is definitely something that we would love to take the expertise of your experience in legislative service about how we should design the outreach. How should outreach look to elected officials to have them tie in to this conversation? So this is why these conversations are happening now for the possible kickoff in April. So, and my experience in government too is early hand usually gets the more grease on it. So we're looking for as much grease as possible, or investment, or ideas, and we're looking also to have the health insurances sponsor a lot of this work. The health insurance organizations that are out there that want to have a healthier clientele, so that people are using benefits and are not using their benefits to this enormous amount of testing happening because they're turning around some of their health issues. We're purposely covering up the sweets and serving the water in classes like this, but we understand that those options are so. When I talk about food policy, it's talking to like we mentioned to the bodegas, the supermarkets, the potential city-run store, the Audis, and everything else, about having opportunities where they're partnering with us too, to say if people who go to these symposiums or go to these events have access to those giveaways that's going to promote people to have to go in and catch a sale where a pack of oranges is worth this, or you go to the beets, if you can get that. And I learned how to take these beets, and you also work to excite children, because I heard if you get a kid who's going to say to you now when you go to the store, "Papi, remember they did this in the cooking class? We should buy this. This is good. I liked it when I was there," and it's going to encourage parents, maybe the older people, to take advantage and eat more. So this is all a great information. I wrote that down. How do you take health bucks and cooking classes and get elected official investment to tie into encouraging healthy community.
A lot of these programs exist.
Yes.
Like the green carts also offer right there on the street cooking classes with a recipe, and then they give you the bag of food while they teach you how to do the recipe based on, whatever is the cultural preference in that neighborhood. So I think it's really possible, because I think a lot of these partners exist that could come together. So I think it's wonderful.
We know that we'll see who's going to be who have health committee in their portfolio the next weeks or so, right? So we'll know. As far as legislators, as the other side, we'll hopefully have this. We know what Health and Hospitals CEO already is for Mitch Katz and Christina Gutierrez. He was appointed, and then we'll talk more about. I think the health department is health in charge of health bucks.
They are the ones who are in charge of
DOH.
So you just how you access them, it would be through, I would say, unless you have the money to buy them, how you access them would be through, I would ask for maybe a portion
from each elected official.
From each elected official, and correlate an amount, a goal that you want, a goal that you're trying to reach. The community board touches District 8 and District 17 in the city.
Right. And a little bit of we had a little bit of Cumberland Village too.
Yeah, so
Cumberland Village West.
Yeah.
With the back with the sliver of your office.
I don't know if that's
yes.
It is.
Yep, it was sliver. This is what block, what side of the street?
All right.
Where the side where Cocos Village is at. Yeah. Right.
So definitely, reaching out to those people and say, hey, can you allocate 2,000, 3,000? What does that look like? Because those stockpiles will definitely help you also fill the seats in your symposium, fill the seats in your health fair, because if you're saying, hey, we have this access here, people come. People come, and they come in a consistent cadence, and if you say these are good places and times where you can access them, they'll be there.
What do you think is good days of the week? And this is for the whole team chair now, and I'm done with mine, unless you have more for me. is symposium days of the week that we want to host a symposium.
That's what I was like thinking. I was like, what?
Is a Saturday good too also for those?
Who would be the most beneficiary? Who would be the best beneficiary for the knowledge? I think that it starts with seniors. Seniors are very active during the day,
Yeah.
and
for some reason they like Wednesdays.
Yeah.
So I mean Wednesdays, but also like I mean as long as it's not during their lunchtime
Yeah.
at their centers, it's a good time.
Right.
Yeah, it's a good time.
Right.
It's a good time for them. It got to be before 4, before traffic picks up and everything. But it has to be during the daytime when it's comfortable for them to go. So anytime between 10 to 2, but not that 12 o'clock hour.
Yeah.
It would be a great time for them. And if you can put it close to their center as well, even better.
What do you think about? And the reason I was thinking about a Saturday, if we did it on a Saturday, because you have working class individuals, like we talked about us as we are, how our work day was, where we are focused on work because we have to deal with the affordability issue. I want to keep using the buzzword, but also what's going on in our minds. Sundays is out because we're just beginning a spiritual respite, but then other stuff is also Saturdays usually when we have time to fumble around with some stuff. I'm not sure. Are the senior centers open on Saturdays?
No.
So if we did something on Saturday that would be good to do to see like the time that she talked about.
They would show up on a Saturday. It just wouldn't be late.
Right.
Yeah. And I mean, from my experience.
So 10 to lunchtime, 10 to 12, 10 to 11 to 12. You do lunchtime. This is my opinion.
Yeah.
What do you guys think?
I think again, it would be something 1 to 3, but also we have to go back to the whole survey thing too. Like we gotta make
sure. So survey will
that,
tell everything.
yeah.
You're right.
Well, we definitely want to do. We can definitely.
We have to because I agree with you. Seniors, boom, and then men health. That's important, and that's a whole umbrella. You know,
Children.
the stigma up behind of men not knowing the health or just don't want to or too busy or whatever it is, right? That's what they do. The youngins, they clock it.
Clock it.
But then also women, right? And then you have kids. So it's babies to seniors. We have to target. It's important. But I guess we can try to figure that out, what that looks like. I was thinking of like trying to do like a media video thing where we're just like pinpointing the things. Because again, we also have to talk to everyone. And right now, the next generations are the young generations, and they're on it. Whether is it for them or is a video that's catchy that they can show to their grandma, their mom, whatever it is. I think it's important to just get the media out and be creative. And having I was listening to you with these live conversations and just having like these street talks from CV1 within the area, asking a random person, how do you feel about what's going on with health, the health crisis in general. And it doesn't have to be specifics of what it is, because again, we have to be very cautious of, HIPAA and things of that nature. But people are willing to talk. Yeah. Whether it's, so-and-so clinic says there's a walk-in and they don't even accept walk-ins when we go in, and they got a big sign that says walk-in, and it's like, how do we
Or the big thing I heard today is that I was not clear on what insurance they take.
Exactly.
So they got sent back away.
Exactly, and that's important. You have clinics that are not held accountable, and that's okay, but we want to make sure that we are relaying the information accurately and no one is being tarnished or cancer culture, whatever it is. Yeah. But it's like, hey, you told Jane Doe that we accept all insurance, and then all of a sudden, Jane Doe comes in with Aetna, and Aetna, they don't accept Aetna Medicaid. They don't accept Aetna PPO, whatever it is. They accept Aetna Medicaid and all this other stuff. So it's like give me the clear sense of what you guys accept, and it's not just one specific clinic. It's all over the place. It's like something we have to be able to, communicate with the community and understand what is going on. And I
want to add, and before you jump in, is that the chair also directed us to, and that before this, someone needs to come in, whether it's the federal government, the state government needs to come in and have a conversation about medical insurance and what is, because you hear this, CNN says this, ABC says this, CEC this, so we want to be able to have a clear conversation about whether it is a Facebook conversation or YouTube conversation where people are typing in their questions about medical coverage. What do we need? What one-on-one? What do we need to know? because people need to understand, as they already heard, some of us have made health insurance. We had recently, city workers have to make recently. We lost our health insurance, and I won't go into details about my personal stuff, but we understand that everyone is feeling the brunt of it, and how, because also we want to create not only a stronger patient but a stronger constituent, so they'll know if the elected officials are speaking to this issue that matters to them, whether or not mommy has the ability to get that operation, or as the chair said, the baby gets the chance to get those shots, or the baby's born healthy. What are those things? So we need to be able to start having a conversation about medical insurance.
Yeah, but also the most important key is being a safe space, because a lot of the times the community feels that they are just a number, they are just a statistic. It is not about that. It is about tackling and figuring out how we can be able to provide resources and improve people's mental well-being, and also provide those resources that they feel comfortable going to, and not just, here's a flyer, this is what we do, and that's it. No, it doesn't work for me anymore. So that's the main reason why I'm taking this so serious, and I want to ensure that we can be able to brainstorm, moving forward.
Quick question. Does there, along the lines of what you were just saying, is there some sort of recognized symbol, or that it's like, this is a ICE safe space? It's not, like, I don't even have, like, there are symbols like this is a safe space for this, or I don't know, does that exist? Because if not, we should even just have that written, this is an ice cream zone, because it really is affecting.
I feel like that's gonna put a target on the programming.
Does it? Because there's any way that we can let them know?
I think so.
Go ahead. Yeah.
So, couple things. Firstly, I love the idea of the street talks, and I think specifically with the youth is we can take that street talk forum and record it, right? We don't have to record the people, but we can record what's being spoken about, put it on a link tree on the Instagram page and on the Facebook page, et cetera, et cetera, et cetera. So people can go back and it's clearly labeled how to navigate insurance, how to navigate Medicaid, Medicare, how to navigate whatever. So that will make it accessible to our parents, our mothers, our fathers, who are literate, have media literacy and can access it from there, while we're still using the same forum to educate our senior base. So it doesn't matter which day, because it's accessible online, but we're akin to the senior base because we know that there's a gap in that literacy base. And I think also bringing that information to, like, different organizations that focus on maternal health, and providing those links so that people can fully dive in their own comfortable space. It'll really help. This recently, in the last 2 months, I had the pleasure of starting a mental health facility, telehealth for my mother, who just became a psychiatric doctor. And I think the number one thing what I'm seeing across the board is people like the telehealth option because they can do it from the privacy of their home, and it's in a comfortable space that they can create. And I think we don't, in the medical industry, give enough space to specifically these telehealth options, because there is a fear of how legitimate are these places. I can say firsthand, if I am not the person there selling the business is not going to be sold. Because people don't trust, and this is a culture that we've established here with, the scams with the phones, and the scams with the iPads, and so people are not willing to just give up their information in the ways that they used to before. So we, as a community board, should really do work on trying to find mediums how we can just break down stigmas in the telehealth market, so that people can access their appointments from the comfort of their own space, especially in this environment.
I hear you, and I think that's a great idea. I'd like to go back to safe spaces because it's a real barrier. I mean, I don't know what exists out there, but because I do arts and health and I work with, agencies that use it, State Office of Mental Health, Urban Health Plan, and I'm sure you saw too. There is this real fear of maybe there's, this is a safe space where we communicate, you won't be asked for any information, you won't, I don't know, whatever that was my first.
And that is something that we spoke about last week. I think
Just to make it accessible for people.
That is so important. I think the health fair, and I know that we are jumping back and forth from the health symposium to the health fair, but for both. But specifically my mind, how we were discussing last week, brainstorming, is like having all these mobile clinics, right? And being able to just provide those safe space.
On-site.
And
Well,
then
making it
on
clear,
site,
like, you won't be asked for any information.
No,
or this
yeah,
is a safe
exactly.
space. This is a,
And
I don't know, what,
exactly what you were saying about the telehealth, having people who
yeah, they're not gonna.
don't
give
work
information.
in a regular clinic, but also provide some form of an incentive
Mhm.
or something that say, hey, this is what we do in case if you don't feel comfortable going to ABC, this is what we offer.
Offering
And then,
telehealth.
yeah, so that's why I want you guys to chime in on all these stuff, because it's like, it's not just like getting like the well-known clinic or the well-known
Mhm.
hospital. It's not about
Because
that.
people do that. That's what they jump to.
Right. And me personally, based on my experience, and I'm happy to share that, I was 27 when I was diagnosed with thyroid cancer.
Mm.
So for me, it's like, how is that even possible? That doesn't even fall within my family line. And William was 2 at that age. So I can only imagine how other people went through those experiences without even realizing that it's not a part of their family history. How can we be able to educate the community?
Mhm.
Okay, like I had to go through a full list of mental breaks just to figure out if I'm gonna be okay. Thankfully, it didn't do chemo radiation. They caught it early, but that still, like I was that 1%, but that still doesn't define, like other people didn't have that opportunity, right? And so I say this because it is important for me, but not only for me, but for everyone. My child, every community we walk through, every stories I hear, it is important to try to figure out how we can be able to provide those resources. It doesn't have to be a specific hospital. It doesn't have to be a specific clinic. If ABC Clinic provides behavioral health or any kind of support, that's what we want to be able to, inform the community about. And that's important. Go ahead, Audrey. Audrey was waiting. She's like, yeah, I was looking.
It's just like so many things you guys covered that I wanted to interject into
Sorry.
one thing that's just been pressing in my mind. A lot of people, me included, are getting to retire.
Yes.
So now we could include that as to explaining our benefits that are coming from Medicaid, CA, because it's confusing.
Yes.
Yeah, no, it is.
It is very confusing.
It is.
So that conversation could also be implemented into either the
That's-
symposium.
That's what my grandma said. So she retired, right? And when she retired, they told her, because you're getting this amount of retirement, you can only qualify for this
Which
and
is
this.
crazy.
And then you have to pay.
Yeah.
And then I was
Like,
like,
I'm in that situation.
right. And then I was like, well, I worked for social at that point. And I was like, well, let me connect you because this is what I hear.
Yeah.
If it wasn't for what we know, she would not be able to. She would end up paying the $1,200 instead of paying
thousands of dollars.
the $60 per
Exactly.
quarter, whatever it is,
And
right?
the
The OTC part.
entitled to.
I agree.
So, yeah, make sure.
I agree. No, because this is very important.
Because I'm sitting here and like with the changes with this administration that's going on with our benefits and like he just mentioned that he's losing his benefits. It's happening cross board.
Oh, yeah.
All city employees, the private sector is different, but you still out of pocket is changing, the OTC is changing,
Dramatically.
everything is changed. So I'm confused as to I'm at this point now where I have to start getting my compensation.
Are we able to also, look, I'm sure we are, and we will do it. It's just like a poll of like everyone in the community just expressing those type of concerns,
Yeah.
right? Because it's important. When you stepped out, she was talking about retirement, the aftermath, the
I'm
insurance,
jealous.
the benefits, what she's able to qualify, what everybody else is able
The
to qualify.
breakdown, how they gotta, because when I went, I'm
What's
trying
the
to do that
copay?
now, what's exactly, I'm getting this information, so I'm getting confused, I'm getting frustrated, because they say, oh, you have to do this at a time,
Before you
You
get
have to do
penalty.
this time, you're gonna do this, and I'm like, and I go to Social Security, and they're like, that day, an appointment, I went to the Social Security office to sit down and talk to them, and they're like, it's too soon for you, but even if you're not retiring, it's gonna cost you this much.
If you do,
I'm
yes. So we need to
I'm
tackle
not
all
gonna
these
do-
things.
I think there's an opportunity for the chair to do some interviews and
Yeah.
maybe some testimonials with some seniors on what's going
Yeah,
on.
I'm a
with this
senior,
stuff.
and I could do a
And maybe
testimony.
We do have a seniors committee, which it's usually at 1, right? It's at 1.
Yes.
It's this
Tomorrow.
Wednesday.
on Wednesday.
It's
And then,
Wednesday.
and they have opportunity to do the survey also, so that we'll hear a lot of surveys.
So yeah, so the survey that we discussed last week, it was not just for health and human, it was for overall for the entire CD1, and then hopefully, obviously I'm sure other community boards are doing it, but it was just to get us to meet everyone in the same path, because we're a little bit behind with a lot of stuff, surveys and things of that nature.
So there was another thing that was pressing in my mind was like, there's an organization, the New York City Prevention Access Program.
Mhm.
They deal with everything that you were just talking about.
Yeah.
Because they're going to, and
So
the Connect to Care program also involves all this.
So
Everything's
the
going-
document that Christina created, we're gonna pretty much start adding on. We're gonna start.
I'll add our notes.
Yeah,
I'm
we're
taking
gonna
notes.
add on, right?
Yeah.
And so what's important is for us to, Anthony already expressed that he has everything covered in terms of like connecting with like yeah, I know, we're connecting with the mayor's office of mass engagement, tabling, having mobile clinics, being able, it's not only a health fair, but it's a fun event. It's in a playground where we know that there's gonna be parents that's gonna feel amazing on a Saturday. They take their child to a park on a nice day, and they can get all the information that they can be able to get in one shot. It's like a one-shot stop. So we wanna be able to get, have everybody just
Can I have
input.
one last
Yeah.
thought? Just one last thought about everything we've talked about, and I know I've brought this up a few times.
No, go ahead, yeah.
But briefly, is there any way to go to parks, to city parks, to give the Bronx money? For now, we're going on 4 years of having St. Mary's Park and the community center closed, and all of that money that was supposed to go for that programming really needs to be distributed at other centers or other parks that are able to do this programming.
We mentioned that in our meeting, and the response to that was that they find every time it's like an onion. Every time they fix something, they peel another
That's
layer,
fine,
and the
But
money
that money
frozen.
is for construction.
Yeah.
There is allocated
It's frozen.
staff program money that
that you
has to
gotta
be,
use within a limited time, and then if not, they take
Right.
it back.
and they take it back. So here's another year passing where there was all this money that was allocated for staff, for things that are not being used, where we could, I personally would love to also see them go to the NYCHA community centers,
Exactly.
but there is a chance to go to, I feel like we should be with our new councilwoman. I've had this talk with Diana, and she agreed. It's just about putting pressure, right? It's just about,
Yep.
so I just want to throw that out there to
No,
cover
that's
maybe
fine.
music and food, and, because people respond when there's food and when there's music, or, I don't know. just to
Yeah,
cover
that's
some of
a
the
note that
costs,
Anthony
you
wrote.
know.
That's a party for me.
Just something to think about for funding.
Our colleague from the city council is good to add a little bit, but not no truth, but his thoughts.
What do you say?
Well, we're on live, so.
But he's a private citizen today,
He's a private
Just a
citizen, yeah,
constituent.
today.
constituent.
Just a constituent.
After life is off, we'll disclose.
Oh, sorry.
Ultimate.
What I did want to say is, there's one part of the conversation that we really have to speak about, and I don't know if we want to involve another committee in this,
Mhm.
but we really need to talk about building a healthier South Bronx. And when I mean building, I mean physically building a healthier South Bronx. A lot of our infrastructure is not designed in a way to prevent asthma. A lot of our infrastructure is not designed in a way to prevent these kind of, yeah, and this is, and I think that it's
Partnering
worth
with,
the conversation.
South Bronx Unite,
Yeah, or
it's like other organizations, yeah.
organizations, but even
And the
committees
Heart
within
Center,
within
yeah,
the
yeah.
economic, but even committees within this
Heart
board to
Center.
really sit down and say, okay, we have all of these throughways that cut through our communities. How many trees exist in this
Yeah.
one area? How much of this carbon dioxide is being sucked up?
But I hear you say that it's way bigger than health and human, and that's what I want. I wanted to tackle, environment, economics, all of that stuff, but everyone, sanitation, everyone, because as I mentioned, we were trying to open a dog park a few months ago, and then we realized that there was a lot of needles and just, there was a lot of red tape. And so, we also want to be able to cater to that population as well, where, individuals have fairy friends, and those are their children.
Mhm.
And it's not okay to walk around communities and you have needles. So imagine a child, imagine a pet.
Yeah.
So I want it to be open for everything. I did confirm some tables with ASPCA and things of that nature as well. So it's like catering to every single one.
Mhm.
That's a valid point. Asthma, having the air pollution, all that stuff. That's important for the residents of CB1, where they live in the heart of the area and they're
Experience it.
inhaling.
We gotta get that guy, Michael, what's his name? With the white beard, the tall, skinny guy. He's African American. He's always advocating for the asthma and
Talking about Michael Johnson?
I think it's Michael.
Oh, Michael Johnson.
Yes,
from
it's about,
that
South Bronx United. Yeah.
Right.
So,
He's always
So
advocating.
I like what Tariq is saying. Because when I was in Congress for a little while, I used to watch. Well, not a little while, but as long as I was there, was that we looked at the decade. No, but it was a decade that I spent there. But I like the idea when you talked about construction and buildings that encourage people taking the stairs versus more taking the elevator, but not the stairs that's going to be so steep that you're gonna end up making it hard for you. But it's stairs that have it's kind of interactive. That's exciting. So you're saying it's saying five steps. You can burn a quarter calorie. Get your education. Along with that, it's encouraging when you're building parks. You're building parks saying you do this 10 times. You are going to build this muscle. You're going to do that. So I get what you're saying that you not only chair. Like you said, is not only thinking about the person, thinking about the dogs, thinking about everything in your community. Building the street, making a little statement about this is the 5,000th tree that is built, and that will. We hope that this will create, whatever, and improve the quality of air pollution. So mixing education with everything you build, everything you do.
I want everything at this health fair, and
so you want to stimulate policy together.
I want everyone to feel like they actually went to a health fair that was very informative. They got incentives, they got tote bags, they got giveaways, they got programs, they got list of places where they can go.
Intentionally, be intentional.
They have an appointment. You know what I mean? Like I want arts and crafts. I want a bouncy house. You name it. These are things that
someone is doing aerobics there and
someone is doing aerobics.
Roller skating.
Yeah, having somebody do arts and crafts.
Yeah.
Like parks is known of having all these events, and let's be able to invite and just promote and just allow the community. So I'm really happy about this.
So we need a floor plan. Different things is gonna be.
Yeah. So I already have the blueprint already.
And a timeline? Do we have a timeline?
And we do have a timeline. So the timeline is the following. We wrote all of this down.
Yeah.
Fantastic.
Yeah.
Late April to
You guys
May,
are
the health
awesome.
symposium.
Yeah.
The health fair
It's right here.
first.
You have it? You have that document?
No, I have the document.
Oh, it's on
I
your-
have it because he only printed it to me.
And then
So we have the permit application. We have to make sure. So the survey development is literally this month. We have to ensure that is in compliance and completed in terms of things of that nature. Right. What I want to do is
No, not just the interns.
Okay, well,
She's gonna tell you. It's the interns and
what?
the committee members. You guys are all responsible for that.
Yeah,
She's-
and us.
Right? She's just saying it's the interns.
And us as well. So it's not, because the interns are doing whatever
That too.
things that they can be able to do, but also I want to make sure that I am communicating with you guys on an email basis, also everyone else as well. But also where I was thinking of doing like a WhatsApp group chat for us, just specifically on the ideas, because let's be real, you guys are busy. I'm unemployed. Just
I
I'm unemployed. I'm tired.
I'm gonna be retired soon, so
And I'm so proud, but I get to give my time a little bit more to the board. But I know you guys are busy, and I think if we can do it on a WhatsApp, it like kind of helps the stress of like reading the email and responding. I think the back and forth in the email can be a little redundant. So just having that on a group chat will help. That way Dennis can input all his ideas and things with Lincoln. And DM can be able to chime in of any update of the status of the permit. I know that we need to secure that as soon as possible. So the permit application is by February, so before the next committee meeting.
Okay.
Right? Then we have the survey distribution, which is actually considered, so we have the Lincoln Hospital meeting, that's for the symposium, correct?
Yes, ma'am.
So we're gonna have a meeting with Lincoln and Dennis, most likely
And
in
Marcelo
February.
and
And
Tony
Marcelo and
and the crew.
everybody else, the whole crew.
All the public health crew.
Right, and we need to get their
With-
input on what that health symposium was gonna look like, so that's gonna help all of us, be a little bit much more, like connect on what we're gonna do. The survey distribution, I consider that as the outreach. It's not like Tariq said, it's also something that we have to do paper form as well, which is accurate, QR code. I wanna be able to take the initiative to have a team of people who can actually do the outreach. We have so many residents behind here that had expressed concerns about being, having the community active. We're trying the best that we can, but we wanna be able to over exceed the active and just have people just support with the outreach throughout the communities. If you guys have any input, that's what we're gonna share on the WhatsApp group chat. The sponsors outreach, that's something that I have to tackle. We can all tackle by February, just getting, tables secured, for the health fair. That is important because remember, it is a big event. And we wanna ensure that we get the confirmation from everybody. If they're able to sponsor, we need a DJ. We wanna be able to get incentives. How much are they, things of that nature. So we have to get to the logistics of that. The vendor outreach, we have to do that before March, and the symposium is April, May. Do you guys have any questions? Yes.
As this is fantastic,
All it is,
and
it's
I
the
really enjoyed
it's the right, the
It's
timeline.
really a
Make
good,
that.
it's really a
Thank
good take on
I
this.
know.
My question is this, would it be possible, and I'm not trying to add another thing. to
No,
the
go
list,
ahead.
But you have it in your head, like,
Yeah.
what would be the action list that you're looking for from committee members?
Yeah. So
Because you have a lot figured out, like,
yeah.
okay, by, February, by March.
So you want me to distribute, like, who can what?
Or just make an action plan, these are
Yeah.
the things we need, community up, or our,
So that's
committee.
what WhatsApp is gonna do. This
Yeah,
Robert's
so
gonna
the
give
WhatsApp
assignments. It's
is
gonna
gonna
give
bring-
assignments. Boom, boom, boom,
Yeah,
boom,
so
boom.
the WhatsApp, that's why I wanna include you guys in the WhatsApp, group, and it's pretty much gonna jot down, like,
Exactly everything she just said.
yeah.
Okay,
And that
yeah,
action
just to
plan.
have like a schedule, a plan of action.
Yeah.
An action plan for us, so we know what to keep ourselves.
Like, if you
on
have any
track.
connections with any sponsors or any,
Please submit by,
right,
just make believe, February 1st. If
Right.
you have any this.
Do you have a template that we could use to when we talk to these vendors and everything, something that, that will show that this is what we're doing for our
DM?
community?
DM.
Yes.
Yep, this is
Yes.
all we discussed on
We got your, we have a script for you.
We have a script for
So
everyone.
you don't get in trouble and you don't and you do
And
the
we're
right
just
thing.
sticking to the ABCs,
Okay.
we wanna, and again, I also added, on the list, we have the YTD, Parks, Health, FDNY, Food Bank, LGBTQIA Task Force, Destination Tomorrow, SAGE, all I want everybody. Like, no one should not feel,
Elected
they're
officials
not
gonna have
included.
tables. The health insurance gonna have tables.
yes.
Everybody's gonna have a table.
Everyone is gonna be
This
held
is
accountable
so
to come to their presence. Their presence are highly encouraged to show up so that they can engage the community, so that they know that we are taking them serious, that the community is being taken serious, and they don't feel like they're behind.
So we gotta start working on a permit, right, for the park?
Yeah, so Anthony got that. Once when we are in communication with the interns, that's why I wanna put you guys on the group chat. If we can be able to, communicate with the interns, if any ideas. I have 4 flyers I already created. I'm gonna be able to send that to you guys.
That's
It's gonna be-
amazing.
Yeah, and it's different month of each meetings, and then also,
Yes.
depending on what the health symposium is gonna look like. Obviously, I already have something for the health fair, but because we need to wait until the sponsors and elected officials and everybody else.
Fantastic.
Right, yeah, so everything is Yeah. I'm unemployed. What can I
Wow, you
say?
are on it. That was really, it becomes much more doable, right? When you
Yes.
start listing these things that, okay, this is in place and
It's
this,
long
Oh, yeah.
you
overdue.
know, limits give us freedom, right? Like in terms of like planning limits, like, okay,
Yes.
here's our schedule, here's our end date, start date.
Do you guys have any other, and like, I'm sure once when we connect with the group chat, we'll have so many ideas. You know, my son said, I was joking earlier, my son said, make sure you guys have something with behavioral health. And I was like, are you joking? And he's like, no, I'm serious, Mom. Like, and children who are autistic.
Bullying falls
Yeah,
under that.
yeah.
That's how old her son is.
And
Yeah,
one
he's
last-
10.
He's 10 years old. He's thinking about behavioral health.
Yeah.
So people are seeing that there's
That it
shifts in
matters.
people's
He was
at
thinking
that
about
age.
so much things. He even said he was like, there's ice roaming around. He's like, Mom.
Maybe that's also
He was
mental
like-
health, right?
He was like,
Stress.
if my friend, he was like, can we adopt my friend? And I'm like, who are you? Like, who are you?
Change maker,
And I'm
agent of change.
like, who are you? But it's important because I'm hearing these things from a 10-year-old.
Mm.
Now imagine how other people feel and don't have the courage to be outspoken.
Yeah,
So that's important.
And one last thing, will we be able to translate some of the things into Spanish because
Of
it's
course.
Okay.
We're gonna do Spanish, French,
Oh, that's great.
Spanish and French and English.
English, and any other language that anyone is open
So we'll
to.
work with Moya
Yeah.
and see if they have,
French and Spanish would be great.
they're still the same, right? The name of the agency.
Yeah.
So to try to see as much
Oh,
as
that's
possible.
fabulous,
yes.
fantastic.
And hopefully we'll encourage our major health institutions to bring or tablers to have people who speak multiple
Trilingual,
languages.
bilingual.
And
as
we
possible.
encourage all of that. So, this is in the works. We already just listed everything on what that's gonna look like. We will be in communication. I am so serious. We have to get this done this year. I don't, like, we kept postponing.
So, in your executive board, just throwing it out there, you guys could mention this, because each of those committees, like you said, we're including everybody. You should mention all this into the executive committee.
Yeah, the vision, we spoke about this last week. The vision is to include every committee to be a part of this health fair.
Yay.
And
As well.
the ask for Paola from the full board chair is that each of the committees is doing at least 1 to 2 major projects in the 10 months that we meet
Yeah.
as a board, that 2
Wow.
major projects are going.
Can we collaborate with our project?
It'd be great to get the youth in.
Well,
That's it.
my committee is gonna collaborate
With
in the
multiple committees.
everybody's committee, but the upcoming committee that I'm gonna collaborate with is immigration, for sure.
And
Because that
even
is
land use.
that's like a dual, and
That's
land
huge.
use and
Yeah,
municipal.
exactly.
But I want to add one thing, and I'm going to be intentional if I may, is that to make sure that we are also speaking to the LGBTQIA health related issues to impact it. So we know that Lincoln has a clinic or the floor division that works for sex change and other, but we want to make sure that we speak intentionally about what are the needs for the LGBTQ population, because we know that there are some barriers there. Just like there are some barriers with women from countries in Africa who do not want to be examined or cannot be examined by men physicians or professionals. And so we want to speak to that issue being a barrier and what our hospitals or clinics doing to meet those barriers wherever they are. It is unfortunate that Lincoln is, well, I want to say Lincoln because it's a hospital, but hopefully we want to charge the other hospitals. There's Bronx Care, there's, we're going to go as far as St. Barnabas should be having gender affirming clinics or healthcare facilities in their places, because if they're
they're trying to suppress that, so we need to be out there.
right. And not only that too, I find it as a DM here, I'm learning it more than I am when I was in the elected officials office, that many of our constituents are going elsewhere for most everything.
Yes.
Elsewhere for clothes shopping, elsewhere for mental health, elsewhere, like you said, we're going to the hospital, we thinking our hospitals are better in other places, Columbia, Presbyterian, whatever. Not saying I'm on Lincoln board side, altogether Lincoln. But I want to say that it is that that means that we should, of course, evaluate, but also set a standard. What I'm hearing the chair say, what she said to me was because we were our team needed a little support to be 90 days from the last time when she first was conceiving this baby, is to say that now she'll be on it. And we were having, it looked like if anybody walked in, it looked like we were having an argument, but we were just having a passionate conversation because we both wanted the same thing. We just wanted, we just was walking on different roads, expressing it in different ways. And then when we came back, we were like, oh, why you went that way for? You should have followed me. No, because I need to go the own path. That's exactly how healthcare is. Everyone wants to be healthy, but people have taken different roles, different ways of doing it. And that's kind of like how people do, shopping, hey, there's a sale over here for this, there's a sale over that. So that's kind of how people find out about. So we need to start setting what our best practices in our facilities and our communities, what are best practices in our stores and our restaurants, so we can set standards and for everybody, because we know we're gonna have people who need harm reduction services, people who are addicted to drugs and alcohol, to so many different things. And it's like the chair was saying when she was thinking we should do it in Pulaski Park, because I was going to throw a party somewhere else. He was like, "This, why are you doing the party over there? It doesn't make sense." And I couldn't see why, because instead of doing it, closing up the street and doing all the other difficult work, why can't we just be simple and make sure that we are intentionally impactful on purpose? Thank you. Yes.
Yeah.
So just in the short term, tangible and kind of breaking down those barriers and those screens, we could definitely the work of the board and the committee could definitely call all the major insurances, as we were talking about with the telehealth options, and just ask them who are your providers, so that way they can give us that kind of index, that list, and that can be a principal list that we can have here. Hey, which insurance do you have? Well, Fidelity. All right, cool. Here's all your telehealth providers that's in their directory that they can have access to. It's public, it's information that they can access themselves, but it's just here for them to just kind of break, because a lot of this stuff is a literacy thing, right? There's a stigma, there's a fear around reaching out to your insurance and et cetera, et cetera. So it's like, all right, I'm going to give you a printout copy, and now this is for you. And maybe we turn them into Excel sheets to put them online as well, so that way people just know. Now, obviously, the directories are going to be ever growing. Every day there's new providers. Every day there's new providers. But at least we have something baseline to get people started. It might help the conversation of breaking down the stigma and creating access to healthcare.
Yeah. And if we're telling and building on what he's saying, if we are telling health insurance, not enough of you are allowing telehealth, and most people are comfortable with that, that we can change even that standard to say that they're out, so they're going to be like this, oh, they're over there thinking that. And it's because, the reason why, and I'll end with this chair, and I promise I'll stop, is the reason why they take things away from us, it isn't because they think that we're not educated about it enough, and we don't use it enough, and so it's not.
We have to be able to change that narrative as a community, where we have to ensure that we are preparing the constituents, and that they are they have the playbook. They understand. A lot of people don't have the playbook.
When the game not playing by their rules.
But it's true.
No, for real though.
It's true. They're too busy. They're too busy getting the baseball handbook and not realizing that the football handbook has the most resources. You understand what I'm saying? I'm sorry to speak in sports, but that I have a son, so it's like it's a little. It's easier for me to get to the point. But it's important. It's important for people to know what to do when they are in a crisis. And right now, this is the biggest crisis that everyone is get worse. And it's gonna get worse. And we want to ensure that we don't scare our constituents. Exactly. We want to ensure that we are providing the support and that they know that we're not, turning away to the other side.
So just
strategically, yeah.
Community Board 1 and 2 are facing those issues.
Yes, I know this.
Because I walk the streets and I'm all over the place, and because I see the difference between these two boards.
Similar,
and the boards where I work at every day up in
completely different.
So I'm like,
I got you.
And I'm proud to be Community Board 1 because I'm out there advocating. I said that's all right, because we're doing things too. You just don't hear about it. We're
on our way, team.
I hear you guys. I appreciate you guys. Is there anything else before I adjourn? Do you guys have any new business? We don't have any new business.
None, Chair.
So this meeting is
motion.
Motion to
Before we adjourn, I just want to say for my first committee meeting. This was absolutely amazing.
Oh, thank
Community
you.
Board 1 is rocking it. And we're doing it from a different angle, so I love it. And I
Thank
look
you.
forward to being a part of it.
Thank you so much, and
So happy to
welcome.
have you here.
Trust me, you'll have better snacks next time, okay?
I put a motion, or did I switch to adjourn this meeting?
Second,
Second,
Second by, come and say how my name is.
Dennis.
okay.
All in
Alright,
favor?
all in favor? Aye. Meeting's adjourned. Thank you, guys.
Awesome.
How we, what did you do with Bronx Museum, or you work for the community boards, or?
No, so I am